And let's see, I'll put that. This little guy. Okay. Hot diggity, it worked for a change. Okay. All right, so this week, the discussion is going to be metabolic and systemic diseases. The assignment is going to be working with testing procedures. We'll just take a quick look at it. Since Brandy's already done that, you're going to be explaining how the testing procedures for cholesterol, hemoglobin A1C, triglycerides, and glucose work, and pH. So you'll just look these things up, okay? You can find a lot of this stuff in your MA textbook. I'm not sure. I don't have that chapter number, but yeah, you can just look them up. They're there. But these are blood tests that are made. Glucose can be done through urine, but the more accurate test is a blood test. Urine is fast and it's relatively non-invasive. I mean, it's not even invasive at all. You're putting something out, not getting poked, I hope. Hope you don't need to be catheterized to get a urine sample. But the issue is that those are almost all blood tests, which will also be covered, I believe, in LBT 205. Yeah. So at least we used to do it in that class. Just look these things up. It's short. 300 words isn't even a full page. So it's not that big an assignment. But what I want you to do is look at that. And then the testing procedures will include the sampling procedure. Okay. So include the yep. As how you run the test. I mean, with A1C, there's a couple of things. We have an A1C reader in the lab. A couple of years ago at 9 Health, they had a handheld A1C reader. It was just a finger prick test. They were. That's a relatively new device, although it works pretty well. It works well. And so we do have that. Cholesterol usually requires more. You need to have a more specific test than that, as well as the triglycerides. And you all know that when you go get your blood work done, you don't just get cholesterol. You get total cholesterol. You get high density and low density lipoproteins and the ratio, which is really the critical information. And triglycerides is a separate test. Triglycerides is how fatty acids and oils and stuff are not water soluble. So they actually are solubilized in the blood as compounds that are attached to a glycerol molecule. Glycerol molecule can have 3 things hanging on it. That's why they're called triglycerides. And different kinds of fatty acids. You've all heard about omega-3s and omega-6s. Well, there's all sorts. The long-chain fatty acids range, have a very wide range, and they appear in different things. And the chemical structure is predictive of whether it's going to be an oil, a fat, or a wax. Okay, so we can tell a lot, and there's a lot of things. One of the reasons, and there's this thing about highly unsaturated fats. Well, things that are hard, like beef lard or beef fat and pork lard. Those are largely unsaturated, largely saturated fats. Very liquid oils like olive oil and peanut oil and stuff are unsaturated fats. They're also shorter. We call them long chain fatty acids because they have long chains of one carbon atom after another. And they can range anywhere from 12 carbon atoms long to 24. And so the identity of those is predictive of the kind of oil or source they come from. Animal sources tend to have a lot more saturated fats, vegetable sources, unsaturated fats. Piscine sources, fish sources, tend to have a lot of these what we call the multi-unsaturated fats. You've heard about them called omega-3s and 6s and 9s. And those come out of eggs and out of fish. We have been buying eggs from a lady that has a 5-acre chicken farm in Wellington. We pay a bit more, but we can get duck eggs, chicken eggs, varieties of chicken eggs, and even guinea fowl eggs from her.
The little blue ones?
No, the little blue ones are robin's eggs. The guinea fowl eggs are speckled and they're about that big.
They're brown.
They're brown, and they are also very, the white is very, very thick. It's a very different kind of egg. But we buy them from her. They're a bit more expensive. It costs us about $6 for 18 eggs. But the duck eggs, they're this big. So, they're about double the size of a chicken egg. And, we enjoy them. But she is basically, they're free range. There's no antibiotics, and they feed them with stuff that they're supposed to eat. Chickens, we see people throwing out corn and stuff, and in pen-fed chickens, that's what they eat. Chickens, one of the funniest things I have ever seen in my life is a box of eggs at a natural food store that read organic, free range, vegetarian brown eggs. Chicken's favorite food is maggots, fly larvae. A free range chicken cannot be vegetarian. It's impossible. It's stupid. I mean, they eat it. They eat what they can get in, and they like bugs. They eat bugs. And by the chicken feed that we feed them, and chicken feed, of course, has its own other meaning, right? But the chicken feed that we feed them has really eliminated largely eliminated the omega-6s from eggs. I think it's the omega-6s. Anyway, it's really changed that ratio. Not for the better. So we've gone to buying eggs now from Ella, and she delivers them to our house.
That's cool.
Yeah.
Get to my house.
Yeah, they're really good.
I love free range.
Yeah, I don't have her number with me. My wife does all the contact, and Ella just comes over, and whoever's home pays her.
Right.
But she also does yard work.
Because my grandpa or my cousin from Oklahoma. And
There's a world of difference, isn't there?
amazing. Just
Yeah.
blow your mind deliciousness.
Yep.
I was like, I hate store-bought eggs now. And even the ones that you buy at the store that are free range or whatever, they don't taste anything like his. So I'm just like,
No.
that's a joke.
Depends on the variety of chicken. There are so many varieties.
That's true.
And
Oh my God.
Yeah. So we we get that. Plus, as I say, we get duck eggs and
Oh, yeah, and the
and
duck egg thing.
a
Sounds
lot
pretty
of
cool.
different eggs. Anyway, so that's the assignment. We have the usual assessment. We'll do the in-class testing activity on Wednesday. Then there are a couple of videos on catheterization, male and female catheterization, which you need to watch. And then this CAUTI, catheter-acquired urinary tract infection in long-term care course at Medline University. You take that, and again, just screenshot the results of the quiz at the end and submit that. There's some videos on the female and male reproductive system, and there are quizzes associated with them. So there's a video which you should watch. It'll be in addition to my very quick lecture on them, and take those two quizzes. And then at the end of the week, there is actually another quiz that you'll take for the end of the week. So let's go to the female reproductive system. And this will take a minute or two to download, I think. Oh, it's a lot quicker. Couldn't make it download this morning. Okay. Pardon?
It says I can't submit my
It says you can't? Why? Does it say it's closed?
It says not submitted.
Email it to me. You can always email it to me. Okay?
I tried to submit it last week.
I will, okay, after we get done with this lecture, remind me, I will open up that submission box. It shouldn't have been closed. Shouldn't have been closed. Okay? Sometimes the calendar thing on this just doesn't work very well. Okay. So this comes out of an older text we used to use here for a medical assisting. And we're going to talk about the female reproductive system first. I'm going to go through this. You guys can pull this up and look at it on your own later on. But you've studied this in your A&P classes. So quickly, the central part of the reproductive system, of course, is the uterus and the ovary and fallopian tube, connected into the vaginal area by a passageway that leads to the external genitalia. So the internal organs, as I said, the uterus, the cervix, the vagina, which leads to the cervix and the uterus, the fallopian tubes, which are the route for both fertilization of the ovum, the egg, and also then transport to the uterus. Most of you, I think you both probably know this process. Sperm is deposited in the vagina. It goes up into the cervical area, through the uterus, into the fallopian tubes, and then the small number of the millions that are deposited during sex. Most of them are gone. Most of them are killed off. So this is a sort of survival of the fittest kind of thing. And then one gets the prize. As soon as that sperm pierces the surface of the ovum and the head dissolves and the male half of the chromosomes unwinds because it's super coiled, very, very tightly super coiled, held in place by a special chemical that binds it into this supercoiled state. It pops open, and then the egg will not accept another sperm. Okay. So usually this happens in the fallopian tube, in the far 1/3 up closest to the ovary. And then the zygote is transported. The zygote, that's the fertilized ovum, is then transported into the uterus, and then we have implantation, and then placental formation begins. And if when this happens, that's when you generate the human chorionic gonadotropin hormone that we detect with the urine pregnancy test, which is pretty accurate. Then we have breast tissue. A number of breast tissue obviously serve a purpose of feeding the newborn, and so the breast contains lobes which produce milk. Milk is mother's milk is the ideal food for babies. We always encourage, where possible, breastfeeding, but several hormones control production of the milk and actually the letdown reaction that occurs when a baby starts to suckle. So a graphic here of the breast, we have these ducts, and then the lactiferous ducts and storage areas. So everything starts with menstruation, right? The term menarche refers to the first menstrual cycle that a woman has. On average, it's a 28-day, a 4-week process, and it culminates with the release of an ovum into the fallopian tube. This is where this is what we are involved. Anytime an egg is not present, obviously impregnation is impossible. So basically there are multitudes of ways to prevent unwanted pregnancies. Brandy sort of facetiously said something the last class she was in with me about the only sure way not to get pregnant is abstinence. And that is absolutely the truth. Well, yeah, that's the extreme, but yeah. It doesn't have to be just the female that presents that. Many doctors now, if after you've had the last baby you want to have, and that depends on the people. We stopped at 2 because the second pregnancy nearly killed my wife, and I was not interested.
Yeah, my husband.
Not interested.
We just watched them. It just took him back to the moment where I was born, and both of us had no heartbeat.
Yeah.
He was like, that was not okay.
That would be scary, to say the least. But nowadays there are many doctors that will, if you decided that you don't want to have any more children, because actually the safest sterilization procedure is a vasectomy.
Yeah.
It's quick, it's easy, it can be done in an office, whereas tubal ligation or hysterectomy is a surgical procedure, and every surgery carries risks. So we have lots of things. There are physical barrier methods, condoms, cervical caps. They are variably successful. If they're used properly, they can be really successful. but they have to be used properly and always. And so you want if you want to do that, then be aware that your pregnancy risk is much higher. The other reason you'd use condoms, of course, is to prevent transmission of STDs. And STDs include things that are that include things like herpes and others, besides the usual things we think about, gonorrhea and syphilis and so forth. But there are many of these things that are sexually transmitted. So what we want to do is look at if we're trying to prevent pregnancy, we have these factors to consider here. And really, that is something that each individual and each couple needs to decide. Barrier methods are, are used a lot. They're pretty inexpensive overall, and they work pretty well. And in fact, there are times when you will be required to use two methods of birth control, one chemical method and one barrier method. And that's if you are ever put on, if you're ever put on a drug called retinoin, which is an acne for cystic acne. It is an enormously high risk drug for birth defect. So you actually sign a pledge if you are taking that drug to to not get pregnant, either abstain from all sexual activity or use two methods of birth control. So most people will use, pardon?
I just want to take that medicine.
Yeah.
I'll take pimples.
Well, it's a nasty drug too, so you don't really want it. But what you do is you take you might take a chemical birth control method and make your partner wear a condom. So there are various other things. There's diaphragms, and there's all sorts of ways of restrictions or suggestions as to how to make good use of them. We've got hormonal methods. The problem with hormonal methods of birth control, is that there are some serious potential downsides. They mention here thrombus formation and stroke as being something, and blood clots as being something, and they give you this mnemonic aches for things to be on the lookout for. What they've left off here is that certain of these things also kill your gallbladder. Weight gain, yes. Weight gain is another side. So you need to take them daily. What's not here is that you should also take them at exactly the same time every day, or as close to exactly the same time as you can. And there are people who simply cannot take them. We've got other methods besides oral, the transdermal patch. It works, well, maybe, but they do work. There are some issues with it. The patch itself is one of the long-term patches. Mostly we don't we don't like to leave patches on for more than 3 days. These patches are formulated so that they can stay on for a week at a time. So we can do that. Then there are other things. The NuvaRing is something that came out about 8-10 years ago. Is that what you're saying? Yeah. Longer? Yeah. That's a NuvaRing, not Depo. Yeah. Well, the NuvaRing is pretty effective, and it uses a different set of hormones than Depo. And here we have Depo. We've got Yeah, you went back and forth, yeah. So Depo is an injection, and then you've got Implanon, which is an implanted device. Um, I have known a lot of people that have used it, and most don't have a problem with it, although occasionally some of them have had it work its way out. So, yeah,
They had to surgically remove it. They put her under because it went into her muscle. And it's like, no, like,
yeah, it's not supposed to go.
you're right.
Well, there are complications with everything. I mean, people have complications. You know, there's the T
I did that
stuff
one.
that occasionally will start to perforate the cervix, which is not good. So everything has its potential problems, and the key is finding something that works for you. If you can take Implanon, super. If you don't mind going in for that shot every 3 months,
Not 7 months.
well, it says 12 weeks now. It's a 3-month injection.
Oh.
Solumedrol is every month, but that's
I
for a
just-
different
I
thing.
just know that. I don't know.
Mm,
Oh, no. Oh, no. That's awful. When you're not expecting it. Make
Yeah.
sure you want it treated first.
well, it's all right. You still love him, I know. Anyway, so we have IUDs as well, which have their issues.
Sure.
That's what I've been told. Obviously, I don't have any experience with these things, but yeah, I don't want to either.
You really don't.
But basically, there's a couple of them. Some of them have copper in them, and copper is a really interesting material. Copper is what we call a heavy metal. It's one of those things that we do have traces of it in our body, though, for other purposes. And it seems to work pretty well. But people get pregnant on IUDs. And then there's the one that releases a hormone, progestin, Mirena, which, pardon? You're right. Yeah, that's what. Yeah, the copper T was the first IUD. Yeah.
And then I couldn't get pregnant for like 6 years.
Yeah.
So I was like, well, let me try this.
Right.
And then that didn't work. So now I'm doing chemical, but I also have cysts on my ovaries
Mm.
that get too big. So the
So they have to.
NuvaRing
Yeah.
helps with those cysts.
Yeah. I think
as
that's.
well.
Yeah, my younger daughter uses the NuvaRing and has not had a problem. So anyway, so we have permanent methods as well. I mean, vasectomy, and we talked about this, or ligation, or other approaches. Obviously, an important part of the female cycle is menstruation. There are many disorders of that, just like anything else. You can breed, you can not, you can have no periods for a long time for reasons that we don't know, or you can bleed excessively. You can bleed between cycles. You can, and it's amazing. You can be pregnant and still have what looks like periods. So it can be quite difficult to deal with. Endometriosis.
Can you go back up for just a second?
You betcha.
It says, treat or DNC. DNC is what they did for miscarriage.
Yeah,
Or-
it's actually taking out the some excess tissue that's causing the bleeding. So is DNC is dissection and curettage, which is basically scraping things out. Yeah, but they do a DNC after delivery if you don't deliver the placenta and the whole placenta, or after an abortion as
or
well,
miscarriage.
or a miscarriage.
My baby just died. So they
Yeah.
had to do a DNC.
Yes, they did, unfortunately, and that's very difficult. I
It
know.
was horrible. It was
Yeah,
horrible. Like knowing that your baby was already gone and it was still inside of you and you had to wait for surgery. What the frick?
I can't imagine what it'd be like to go through that. So endometriosis is a disease of the endometrial tissue, which is not just inside the uterus, but also in other locations, intestines, bladder, the peritoneum, and is overdiagnosed from my observation. And so here's a basic diagram of where it can occur, where the foci of the endometriosis can occur. So pretty much the entire lower abdominal area can have a problem with this painful endometriosis. So so this causes the inflammation can lead to all sorts of problems, not just adhesions and obstructions, but pain, a lot of pain, lots of problems with menstruation, lots of problems with urinary issues, and infertility. So we have some treatments. The problem is that endometriosis symptoms are also the symptoms of a number of other different potential diseases. And so laparoscopy, usually they'll go in and they'll look around to see what's going on. But treating it with these various approaches, if that doesn't work, then it probably wasn't endometriosis. One of our cousins went through, we finally just had a real hissy. She had a surgeon down in Colorado Springs that did 3 successive exploratory surgeries to evaluate her for endometriosis. On the 3rd one, we exploded and just, basically said, you need a new doctor. Well, she finally went to a doctor who knew something, went to an endocrinologist, and what she had was not endometriosis, but one of the worst cases of celiac disease anyone's ever seen. And those surgeries did her no service. Yeah. We can also have infections. You all know about candidiasis. You can have inflammations of the cervix, cervicitis, from pathogens that cause this inflammation. There are lots of treatments. A lot of times we'll use candidiasis is a yeast, so we use the foams and the creams or suppositories. And then for cervical inflammation from a pathogen, we use antibiotics. We got bacterial infections as well, pain, and this can come from a lot of different things, but it makes women more susceptible to STDs, and can lead to pelvic inflammatory disease, and problems on pregnancies. So treatment, again, we've got the two antibiotics listed, flagyl and Cleocin are two nasty players. You really don't want to have to take those guys. Other things, we have pelvic inflammatory disease. This can be, this is a description rather than a disease because it's basically showing that this inflammation, this inflammatory process from some cause. It could be antibiotics. It could be other things as well. And again, you see many of the same symptoms as you see with other diseases. So a really careful workup, and you as MA, a really careful questioning of the patient is really a necessity for these things. This list of STDs is, of course, not complete. We know about chlamydia, herpes simplex virus 2. Herpes simplex comes in a number of different forms. Type 1 is cold sores, and type 2 is genital herpes. We've got human papillomavirus, gonorrhea, syphilis, trichomoniasis, and of course, HIV. And we used to think of HIV as a disease of the homosexual community, specifically gay men. Now about 31% of new cases are in heterosexual women. A lot of black women, but that may be, yeah, and it may be due to other social forces rather than anything inherent with black women. In Africa, almost all HIV is heterosexually transmitted. And virtually in Africa, the prostitution is a major mainstay of having a way of life for many women, unfortunately. And the truck drivers in Africa refuse to use condoms or anything else, and so they've just decimated the population with HIV. It's really a well,
especially in this time, because we all know that people like in Africa, it's a big deal in Africa. It's like epidemic, if not it is.
It is a bigger problem in Africa than anywhere else on the planet.
Yeah.
So then we have human papillomavirus. Papillomaviruses cause warts. Your plantar warts, that's a papillomavirus. A wart on your skin, papillomavirus. There's something like 85 or 86 different strains of human papillomavirus. 10 of them cause cervical carcinoma. So we also have genital warts. And genital warts used to be, again, something that we saw mainly in the male homosexual community, but we also now see it in women as well, growing problem. And it's not just the genitalia. There is a disease, unfortunately, and I think some of it has to do with exposure during birth, but some children have these warts. We call them juvenile laryngeal papilloma. They're throat warts. And the only treatment is basically to laser them off because they will block the throat and kill the child. Mm-hmm. Fortunately, it's relatively rare, but it is.
C-sections too.
Yeah.
If you doctor didn't have papillomavirus or whatever, so those C-sections so that the baby doesn't come through the vaginal and get it.
Right. Yeah, that's a good point. Thank you. Okay. So basically, we detect this through a pap smear. Immunization, there are 3 vaccines currently. There's Gardasil, Gardasil 9, and I'm going to lose it. There's one other. We recommend those for um, young girls before menarche, so that if they become sexually active, and of course we hope they don't at a young age like that, but if they do, then at least we can prevent them from getting this infection. So we use these, and actually it was interesting. The governor of Texas, a solid conservative Republican, actually pushed a law through that required that vaccine for young women in Texas. Cost him a lot of grief from many of his fellow Republicans. But I thought it was one of the most intelligent things he could have done. We got HIV and AIDS. We have lots of treatments for that now. Years ago, nothing. And then we got, pardon? It was. Now people are living with it. And we actually have had several cases where there has been an apparent complete cure.
What?
In other words, several years after ceasing medications, we're still not finding any virus in their systems. Yeah. Now they take a pretty nasty cocktail of drugs, but yeah, yeah.
So, yeah.
Yeah, we're improving our ability to treat AIDS a lot. The problem is that the treatments, the side effects are major, but the cost is pretty high. And as I say, we've got a lot of cases of women now having HIV, and HIV is transmitted not just through exchange of blood, but semen has HIV in it. Breast milk has HIV in it, so we can actually transmit that. Won't go into the politics and the long and incredible story of AIDS, but other problems of tumors, various forms of cysts and tumors. We got polycystic ovarian syndrome, PCOS. There are lots of ways of treating those, and everyone is different. Fibrocystic breast disease makes actually diagnosing breast cancer difficult. So we want to be careful of that. We talked about cervical cancer. The problem with cervical cancer is that it's largely asymptomatic until people get really far along the path. And so that's why we like to see Pap smears early on, because it can catch disease before we start seeing any sort of symptomology for the patient. Just to, yeah. So, you guys have had Pap smears, so I don't need to go into that process. But it's a pretty easy sample and a pretty easy test, but a pathologist needs to look at it because we look at the cells from the lining of the vaginal cavity to see if they are abnormal. So we have all sorts of results. And we have basically a number of categories here. And then this takes someone who really understands the disease to look at it. Then again, you need to understand the condition of the patient when you take the sample. Do they have an STD? Do they have some sort of inflammatory process, pelvic inflammatory disease, PCOS, any of that stuff, because that can influence these things. And then there are 4 stages, like most cancers. The 4th stage is when a cancer is spread to other organs, and basically been and gone systemic. Those are stage 4 is very hard to get back from. We can visually examine the tissues. It's a picture of relatively normal. And you can see here, this does not look normal. These would be taken off with a various different set of tools for analysis. This one actually looks like it could be precancerous from the shape of it and this discoloration. That could also be lighting. So we can either remove these things with a mechanical device or use an electrical wire to pull something off. Can leave you feeling a little bit painful, but again, you need to do that. Yeah. We can use cryosurgery, basically freeze the tissues, much like a dermatologist does when you go to the office and they squirt that liquid nitrogen on you for a short period of time. And all they're doing is killing cells that they think look like they could cause a problem. Okay. Diethylstilbestrol is something that was used for a while to prevent miscarriages or premature death, or birth rather, but we discovered that it actually showed a significant risk increase for breast cancer and other cancers of the reproductive system. Endometrial cancers are there. The endometriosis can be precancerous. Okay. Then we have ovarian cancer, which is a leading cause. Most large families have a very high probability of seeing at least one of the women in the family be diagnosed with ovarian cancer. It's very it's a very common sort of thing. One of my aunts died from it. And again, it's a disease that is asymptomatic until it's too late. We didn't even know she was sick. She didn't even know she was sick until she was at stage 4. This is why, we have pelvic exams and why we have, looking at paying attention, looking at family histories and that sort of thing. So and we know about breast cancer. Breast cancer has been a major medical target. We do an incredibly good job now in this country of dealing with breast cancer, but it still kills 50,000 women a year or more. So it is a major problem. And again, most of the time, if we catch it early, we can either do a lumpectomy, take out the offending lump, if that's all that you can find on palpation or ultrasound evaluation, or more radical procedures depending on where it is. And we have the tests for the BRCA1 gene that is and its variants that are really predictive of the probability of developing breast cancer. And we know that it goes in families, and anyone in a family where they've had a family member die of breast cancer should be watching very carefully. And in the case of many, we had one friend in North Carolina who was diagnosed with a particularly aggressive form, and she said, double mastectomy, take them right now. 25 years later, she's still with us. Both of her daughters have had double mastectomies because they had the same gene that she did.
Both tested positive. Had a double mastectomy and hysterectomy. Around the same thing. And so she had to be tested when she turned 5.
Yeah.
And she came back. for it, so they have to do, MRI every 6 months or every
Yeah.
year, because she hasn't done anything for it.
Yeah. But she wants to have another baby and then she'll have the mastectomies.
You know, I'm not complaining about my boobs, but I would certainly miss them if I had to.
Well, her mom has a boob job. She had a
Yeah,
job too.
totally, then have to then replace.
Yeah.
Her
Um,
Her mom used to have, and she's like, give me a
right. Yeah. So there's lots of ways to look at this. But we are doing good. If we catch it early, we have a really high success rate. But there is also this very aggressive inflammatory breast cancer that typically you don't even see it before stage 2. And then we need to need to take aggressive therapy. So there are various treatments are here. As I say, lumpectomy, partial or full, or even or double mastectomy. There are pelvic disorders that involve bladders, collapse, prolapse of the bladder, and collapse of these things. These can be structural anomalies that might be fixable surgically or might not. One way to if you are prone to that is to use the pelvic floor muscle exercises we call Kegels. Pregnancy, well, pregnancy is not a disease, so we know how that works. Come on. Here we go. Okay, so we're not going to go through a whole lot of embryology, but we start with an embryo, and then it moves to a fetus, and then we talk about trimesters, which is from the last menstrual period through the 14th week is the first trimester. 15 to 28 is the second, and after the 28th is the third trimester, when the baby is growing rapidly. And in reality, the baby puts on probably half its weight in the last month. And if anything happens that might precipitate an early birth, interestingly enough, the baby starts developing rapidly, because the last two things that develop in a baby are the lungs and the digestive system. They don't need them in utero. So they're the last things that develop. And I used to work with an embryologist, and was talking to him about this, and he said, yeah, in the last, when there's an issue late in pregnancy, immediately the growth factors start generating, and the gut starts developing, and the lungs start developing quickly. There can be all sorts of complications. Ectopic pregnancy almost always leads to losing that fallopian tube. 2 ectopic pregnancies means you won't have any babies. We have, unfortunately, a very good friend who would be a wonderful mother, except she had 2 ectopic pregnancies. Yeah.
And my mom.
Yeah, they're tough. And now I understand they're extremely painful.
After I was an adult, she got pregnant.
Oh.
She didn't mean to. She didn't even know she could. And
Yeah.
it was ectopic. But she was going to give me her baby because I couldn't get pregnant. So she was like, I was giving it to you. I'm too old to raise a baby. You wanted a baby.
Yeah.
But then my sister, she tried it. Her and her husband got pregnant and were happy. And then we found out it was ectopic, and she almost died. I think I told you about that.
Yeah.
She was going to go to bed instead of go to the hospital.
Yeah.
But it was ectopic pregnancy, so she lost her fallopian tube.
Yeah, I understand they're very painful. There are several different kinds of miscarriages. They range from completely spontaneous, we don't know why it happens, to various problems as you had with the developing baby. The
I have a question.
mhm.
When I was pregnant with my son, they put me on this medication so I didn't spontaneously miscarry because of like bacteria or something.
Mhm.
I don't remember what it was though.
Um,
And I couldn't have sex for like 4 weeks or something.
I don't know what they would have put you on.
Do you
But I
know what the
know there
bacteria
are drugs that will help prevent that, because we actually do use them with people who go into premature um, contractions, and we try to stop that process. And I can't remember what we use, but it's not uncommon, unfortunately. There can be problems with the placenta. The placenta is the life, yeah, basically it's where the baby gets its nutrition. It's a barrier between the mother's system and the baby's system, and it passes nutrients and protects the baby from some things, and doesn't protect them from others, because the mother's antibodies can cross that placenta and give the baby immunity to some infections. So it is an interesting one. Other disorders can be gestational diabetes. It does happen in some women. And unfortunately, what happens is that you're more likely to actually go on to type 2 diabetes later in life. Hypertension, gestational hypertension, we monitor that and we try to control it if it gets too high. And we have evidence of preeclampsia or toxicities. Menopause is theoretically when you can't get pregnant again. What a laugh that is. And so you can either do oral contraceptives or hormone replacement therapy, or many women don't deal well with those and they go for some natural approaches to menopause. So as the MA, you're going to be gathering a lot of this information and preparing statements, preparing a patient for examination, and helping with the prenatal tests, doing blood typing and RH matching. Parents who have mismatched RHs often have to take a substance called RhoGAM. My wife and I'm positive she's negative. That's the bad relationship. So both of our babies, she had to have RhoGAM treatments. Both of our babies are fine, but that's it. And there's a whole lot of tests, so you need to probably go through this. Yeah.
So her and her partner was different. And she needed to clean up. She had like 4 miscarriages before they
Yeah.
realized what was going on.
The second and subsequent babies have to be watched very carefully. Their pregnancies.
She was so high.
Yeah, the second and subsequent pregnancies, you need to go in and actually take a RhoGAM shot at 4 months gestational, maybe 5, and then right after the birth as well. Okay. So anyway, one of the things that, of course, we recommend for pregnant women is take a real close look at nutrition. If you really crave something, eat it. Your body's telling you, eat it. If you are disgusted by the smell of something, don't eat it. Your body is saying don't. It was really hard because in both of our pregnancies, my wife could not stand the smell of coffee. So I couldn't have coffee at home for either of those.
At work, like.
Yep, that's right. I'd head into work and the first thing I'd do is make a double pot of strong coffee. But, alcohol, smoking, look at medications. Many medications can have problems. And of course, you want to be sure that you don't have STDs if there's any chance of that. Part of your role is this patient education. The other thing is, and looking at this is an important issue these days, is looking for victims of abuse. If we learn of abuse, medical practitioners are required reporters. If they see or suspect or have confirmed physical or other abuse that they learn of. So we look at this. Someone walks in, she's got black eyes, she got bruises all over her body, she's, and yeah, right, right. How many stairs can you roll down, basically? And that's unfortunately a common thing. So we need to be straightforward and ask about abuse. And while if I were the MA, I may or may not get a good answer out of someone. You as the MA, another woman as the MA, might be able to get somebody to open up and say, yeah, my husband beats me. Because there's lots of reasons that happens. But remember that when you learn of this, it has to be reported. These are required things. So you want to be aware. And unfortunately, the way child abuse is detected is that kids will come in, present to the ER with broken arms. Babies with broken arms are almost always victims of abuse. Now, a friend of ours, when their son was this big, they got a very rambunctious St. Bernard puppy.
Oh dear.
And that St. Bernard puppy just ran around and he rammed into this kid with his rear quarter and gave him a spiral femoral fracture. Now that's not abuse. That's a dog. But so you have to, again, you need to be aware that sometimes it does happen. But
I was having him sit down, and he's like, why? And he's like moving around, and I'm walking towards him, trying to get him to make sure he doesn't fall. I didn't get there in time. He fell out, hit the back of his head on concrete.
Yep.
Took him to the ER, and I was like, he hit the concrete. Like, fix it. Make sure he's not gonna be like dead. And they're looking at me and stuff, and I'm like, I'm telling you the truth. You can call whoever you want, but just take care of my kid.
Yeah, and they have to do that. I mean, that's a requirement. So I think I have no idea what time it is.
They didn't call on me, but it's probably because of my attitude.
Yeah.
I'm like, call them. Just take care of my kid. I don't care.
7:15. All right. So we're going to stop this lecture. Let's resume this. I thought I'd go ahead and do the much shorter PowerPoint on the male reproductive system so that we can do catheterization on Wednesday. The male reproductive system is a source is composed really of a pair of testes, which produce spermatozoa, which then are stored in a tube called the epididymis, which is alongside the testis. The prostate surrounds the urethra at the base of the bladder, and it secretes a fluid that helps maintain proper pH for fertilization. The penis is the source or the delivery mechanism for spermatozoa as part of semen. And all of this is controlled by androgens, which are the male sex hormones, as opposed to the estrogens, which are the female sex hormones. Now, having said that, males and females each have both sets, it's whichever one is dominant. The anatomy is of the reproductive system, the penis, the scrotum containing a pair of testes, usually, and then the ductus deferens, the vas deferens, carries the spermatozoa to the ejaculatory duct to make sure that it actually gets deposited into the recipient. This is what is cut in about down here, actually inside the scrotum, in a vasectomy. Prostatic diseases that we have: prostatitis, which is an inflammation which causes usually from a bacterial infection, and sometimes we can treat that, but it interferes with the ability to urinate. A disease called benign prostatic hypertrophy is something that is very common with older adults, older males. Obviously, older has to be males because women don't have prostates. But anyway, with older patients, by the time they're in their 80s, probably 85% will have an enlarged prostate. And it can be anywhere from just something that makes them, that restricts the flow of urine a little bit, to very severe. The problem with that is then they become more prone to UTIs. Okay? So we have some drugs that will treat, that will relax the smooth muscles of these various tissues. Sometimes they work, sometimes they don't, sometimes surgery is needed, and there are 5 or 6 different surgical procedures that can be followed. Prostate cancer is the second highest source of cancer death in males. I have a friend who's an oncologist that I worked with for many years, and I asked him one time, how old, I said, because he was saying that if any man lived long enough, he would have prostate cancer. And I said, well, what's long enough, Neil? Mm-hmm. And he said, 140 years or so. And I said, no worry for me. Mm-hmm. But prostate, like breast cancer, prostate cancer is hormonally susceptible. So it's not unusual to have these happen. We look at prostate-specific antigen. That increases with the presence of cancer. PSA also goes up a bit with benign prostatic hypertrophy. So and the best screening for that is blood test. My father takes a medication for an enlarged prostate. He's never had surgery. He's 102.5. So I expect, since I seem to follow his health path, I'm not worried about it. Mm-hmm. So PSA is the level of PSA is predictive of whether or not the chances of prostate cancer are going up. So the PSA, if we see a very big increase in PSA, they'll usually do a biopsy on the prostate and take a look at the cells and see what's going on. There are operable prostatic cancers and inoperable prostatic cancers, but even inoperable prostatic cancers can be treated. So, pardon? With chemicals or with radiation. A number of years ago, the husband of a pretty good friend of ours down in Lakewood was diagnosed with prostate cancer. And he had a particularly nasty form of prostate cancer, and they gave him 6 months to live. They started doing some research, and they found a treatment at that time that was highly experimental, but it was being run out of the Fred Hutchinson Center in Seattle. And this was to take a small capsule of material, not your typical gelatin capsule, but an encapsulated radioisotope, and implant it into the prostate. So they went up there and they did that procedure on him. It was a fairly easy procedure. It was done laparoscopically. And it's 20 years later and he's still with us. So it worked pretty well for someone who was supposed to die in 6 months. We were very pleased because they had a young daughter and that would have been devastating for her. But usually we do a field test. Obviously, this guy is wearing gloves. He's reaching into the rectum of the patient and feeling this little walnut-sized prostate here, and just feeling the size and the texture. So there can be all sorts of pathological conditions, infections, inflammations of various structures. The epididymis can have it, obviously. The prostate can have it. The head of the penis can often have that, have an inflammation as well. There can be fluid buildup in the scrotum. For a number of reasons. It may be pathological, it may be congenital, or it might be injury caused. There are testicular tumors. Men are encouraged to, as women are encouraged to palpate their breasts, men are encouraged to actually feel the surface of their testes on a regular basis to see if they find any hard lump on the outside. And that should be looked at. This mass generally would only be found on one. We can either remove the testicle, or we can go in and surgically remove the lump, or sometimes use chemotherapy. Orchiectomy is actually to remove a testicle. Male infertility can come from a number of different things. There can be ED, erectile dysfunction. There can be psychological and physiological causes for that, and we have drugs that can help with that. Male infertility can result from a variety of different sources that either reduce sperm count or block the vas deferens. A lot of times it's from hormonal problems. STDs do definitely affect the sexual organs, obviously, and these things are becoming more and more resistant. We're seeing highly resistant gonorrhea strains now, and some chlamydia as well. The problem is, of course, they are sexually transmitted diseases. So if you have it, you can pass it on to your partner. So you should check those as well. There are some treatments or some signs that can be seen to indicate the presence of one of these diseases. These diseases are reportable. The CDC requires that all incidents of sexually transmitted diseases be reported to them. So if you have it, it needs to be reported. The doctor is required to report it. So we have a number of statistics here. Chlamydia is the most frequently reported STD. Gonorrhea is the second most reported. 350,000 cases in 2004, and it's just gone up all the time. Syphilis, we have very good treatments for syphilis. We don't follow them, however, they can be deadly. Viral STDs such as HIV or herpes are not curable. We do have drugs that can suppress them. The first drug for genital herpes was Virex, acyclovir, and works very, very well. It's a pretty safe drug as well. There are other drugs now. Genital warts, we talked about HPV, human papillomavirus. We do have some treatments for that. One thing they don't mention is that an injectable product called interferon does a pretty good job. Interferon alpha does a pretty good job on papilloma infections. I think they find that it's not very effective at that point for one reason or another. I'm not sure. Now I'd have to look into that. Okay, so a lot of these diseases are asymptomatic in males, so we need to be aware of what of the possibility of having them. This also is useful in being aware of the health status of your sexual partners as well. HIV and AIDS. AIDS is an insidious disease. What it does is it kills the cells that generate the signal to produce antibodies. And so it takes up to 10 years for AIDS to manifest itself. And then it's almost too late. But we have some potentials. Again, it's knowing your community there. HIV is very much unable to live outside a living host. There is no environmental transmission of the disease, no evidence that it can be transmitted by insects. Although one wonders, since it's a blood-borne pathogen. Condoms made of latex are a pretty good, effective mechanical barrier. And unfortunately, we're starting to see our incidence in going up in early middle age people. No, to be honest. It is the never happened to me test issue. Yeah. No, no reason to. We do have good tests for HIV, including a home test, which I don't know how really good it's approved, but I don't know what the specificity and accuracy is. Mm. Yeah. The problem with AIDS is that it suppresses the immune system. And so we see it was actually discovered when people started seeing cancers and infectious diseases that they'd only read about in medical school, and practicing medicine for 20 and 30 years, they had never, ever seen a single case. And all of a sudden they started seeing these things. And that's how we get started on that. Kaposi sarcoma is a skin cancer that has some very specific characteristics. The lesions are misshapen, dark, sunken areas. It is almost never seen in otherwise healthy people. Okay. It's very much, it's a disease of the immune suppressed. So we have, pardon? 1,000 a month. But actually it's more than that, because right now what we know is that AIDS patients, in order to have the best result, have to take 3 to 5 different drugs per day. They're very expensive. Can be very difficult. Okay, so your job as an MA is to properly drape and gown and position the patient, and observe them. In a vasectomy, the patients, can be, all that procedure can be done in the office. It's a very quick procedure, and relatively painless. As I said before, the vas deferens is cut inside the scrotum, and then it usually is electrocauterized. So obviously informed consent is important. We should be looking at a lot of different things in our patients when they get up to be a certain age. They encourage annual physical exams. The PSA and prostate exam is common. Either a fecal occult blood test or a colonoscopy should be done. And of course, looking for other things. Watch out, be careful about HIPAA, obviously. You've all studied that quite a bit. So, okay, so that's what I wanted to say there. So let's go back to the work for this week. So again, there are the hybrid video for the female reproductive system, and then several of them for the male. You have 2 quizzes there. After we talk about catheters on Wednesday, then you can do the videos and quiz on catheterization, and the CAUTI, CAUTI, catheter-acquired UTIs assignment after that as well. Questions? All right, so I'm going to cut this lecture off.